Hi, my name is Francisco Cartujano Barrera. I'm a research assistant professor at the Department of Public Health Sciences, part of the University of Rochester Medical Center. The name of my presentation is One Text at a Time, Promoting Smoking Cessation Among Latinos. I have had no relevant financial relationship or conflict of interest within the past 24 months. And this is the agenda for today. We're going to start talking about tobacco-related disparities in the U.S. We're going to talk about some community-based approaches to address these disparities. We're going to talk about cultural and linguistic adaptation of interventions for Latinos. We're going to talk about the use of mobile health for smoking cessation among Latino smokers. And I'm going to talk about the work that I have done for Latino smokers living with HIV. In this first slide, we can see the percentage of adults who are tobacco users by race and ethnicity. We can see that there's a group that has really high percentages of tobacco use, and those are American Indians. We can see that 31.8% of American Indians use tobacco. And there are some differences by gender. We can see that American Indian men smoke at 29.3% compared to American Indian women who smoke at 34.3%. Then we can see that there are two groups who have very similar percentages of tobacco use, and those are whites and blacks. Whites have a 16.6% of tobacco use, and blacks 16.5%. And there are two groups who have relatively low percentages of tobacco use, and those are Hispanics and Asians. Hispanics with 10.7% and Asians with 9%. However, when we take a closer look at Latinos, we're going to see that there are some particular group who have really high percentages of tobacco use. For example, if we look at Cuban men between 50 to 59 years old, we're going to see that around 40% of them use tobacco. And then if we see at Puerto Rican men between 30 to 49 years old, we're going to see that, again, 40% of them use tobacco. Then we're going to see that there are some groups like Mexicans and Dominicans in where the percentage of tobacco users is relatively low. Now, I'm building up the case on why we need to do research among Latino smokers. First of all, we need to understand that Latinos represent 17% of the total population. But by 2016, we're going to represent 30% of the total population. So the number of Latinos are increasing. We also know that Latinos are less likely to have access to healthcare. Latinos are less likely to receive advice to quit smoking. Latinos are less likely to use counseling and medication for smoking cessation. And Latinos are less likely to participate in studies for smoking cessation. This low participation is due to two factors. One is because not all the studies are available in Spanish, and we do know that for us to enroll Latino smokers, we do need to make the studies available in their language. We also know that Latinos are what we call non-daily or light smokers. The definition of light smokers are those smokers who smoke less than 10 cigarettes a day. Most of the clinical trials require participants to smoke more than 10 cigarettes a day, and by having that eligibility criteria, a lot of Latino smokers are not eligible to participate. The work that we do, and that I'm going to talk about, is framed around participation of community key stakeholders. In this slide, I'm just naming some of the people who have worked with us for the past 5 years in making sure that our intervention is culturally and linguistically appropriate. We know that the clinical practice guideline recommends the combination of counseling and medication for smoking cessation. It is our responsibility as public health researchers to make sure that both counseling and medication are delivered in an appropriate and innovative ways. And here we have some fun facts. We know that 80% of adults use text messages. We know that 90% of adults who use text messages read their messages within 3 minutes. And we know that 91% of those 80% adults who use text messages keep their phone with them 24/7, even when sleeping. So knowing these fun facts, we partnered with a company that is called Agile Health. Agile Health is a company that provides text messages for behavior change. So we did a pilot study with 50 Latino smokers in where they were enrolled in a text messaging live intervention for smoking cessation. This intervention was culturally and linguistically adapted, working with a community advisory board. Some of the key results are that 100% of participants requested nicotine replacement therapy, which are some medications for smoking cessation, at baseline. This result is particularly important because a lot of literature has said that Latino smokers are not interested in using medication for smoking cessation. So this study exemplifies the importance of offering the medication in a culturally appropriate way. And if we do it that way, then participants are going to utilize it. We also learned that participants love interacting with us, and I'm going to show in a little bit some of the examples in where participants interacted with us. And surprisingly, at week 12, 30% of participants quit smoking. Also, participants reported high satisfaction with this intervention. So what we learned through this pilot study is that text messages for smoking cessation are appropriate, feasible, and highly acceptable. These are some of the examples in where participants interacted with us. We had an automatic message that says, I am 38 years old and I have 3 small kids. I want to quit smoking to spend more time with my kids and someday meet my grandchildren, Maria. So this is a testimony that was sent to participants. And these are some of the responses that participants sent to us, even knowing that the messages were sent by a computer. Maria, God bless you. We should pray to God that He will get us through our addiction, and I hope that God blesses you and your family. Have a good day. Good, Maria, I have a grandson, and when he sees me smoke, he tells me that I'm losing minutes to my life. I want to have more time with him. So something that we were also able to do is to analyze the messages that participants were sending us, and through that, learn what is appropriate, and we can see some of the cultural values that Latinos share. Based on that pilot study, we're currently conducting a randomized clinical trial that is called Decide Texto, Mobile Cessation Support for Latino Smoker. My mentor, Ana Paula Cupertino, is the principal investigator of this study. And this is a study that we're doing in partnership with Hackensack Meridian Health in New Jersey, the University of Kansas, Children's Mercy in Kansas City, and Georgetown University. So the aim of this randomized clinical trial is to evaluate the impact of Decide Texto, a culturally accommodated program for smoking cessation, compared to standard of care on smoking abstinence at month 6 among Latino smokers. 457 participants will be enrolled in Decide Texto, and half of them are going to be in the control group. The control group consists of educational materials for smoking cessation and access to nicotine replacement therapies. The other half of the participants are going to be in the intervention group, or the Decide Texto, and they're also going to receive the educational materials for smoking cessation, access to nicotine replacement therapy, and an intervention that we call the Decide Texto. The Decide Texto incorporates a tablet-based decision-making session, and I'm going to show you in a little bit some of the screenshots, and then a text messaging program for 6 months. These are some screenshots of the session participants using the tablet. Some of the questions we ask is for them to identify their main reasons to quit smoking, to identify why they smoke, some strategies whenever they're facing those triggers. We ask them to set up a quit date. We explain to them the importance of using nicotine replacement therapy products, and we ask them to select which one they want to use, and they also get to see a testimony. Then our text messaging intervention is a library that consists of 712 messages, and one of the key elements of this library is that we do the management of nicotine replacement therapy. What do I mean by this? We manage side effects, dosage, we troubleshoot any problems that participants may have with the medications, and this way we're making sure that they are adhering to the medications. We also have an algorithm in where we recognize if people relapse, and if they relapse, then they go to a track that we call the relapse track, in where we work with participants to select a new quit date and do a new quit attempt. Something we're really proud of is our readability scores. We have our messages at a 3.9 readability score, which means that someone with a fourth grade level will be able to understand our messages in English. And in Spanish, our readability score is 77.4, which means that our intervention in Spanish is easy to very easy to understand. Now, I have talked to you about the pilot study we did with 50 Latino smokers, in where we showed that text messages for smoking cessation are feasible and acceptable among Latino smokers, same as the use of nicotine replacement therapies, and how that led to a randomized trial in where we are evaluating the efficacy of this intervention. So what's next? Part of the recruitment that we have done for this randomized clinical trial is partnering with community-based organizations. And one of our key partners are organizations serving people living with HIV. Now I'm going to present to you the work that I've been doing through a grant funded by the Prevent Cancer Foundation. First of all, I want to talk about some statistics when it comes to HIV. We know that Latinos represent 16% of the US population, but we also know that Latinos account for 25% of all new HIV cases in the US. We also know that antiretroviral therapy has increased life expectancy. However, we're seeing some increases in cancer, especially in lung cancer, and this is very alarming to us. One of the key factors for this increase of lung cancer is that smoking rates among people living with HIV are higher compared to the general US population. We know that among the general US population, 19% of adults are tobacco users, compared to 40% of people living with HIV. And we also know that there's evidence showing that people living with HIV are less successful in quitting smoking. And we also know that among Latinos living with HIV, 35% of them are tobacco users. So all this is the rationale on why we do need to make interventions specifically for Latinos living with HIV. So these are the specific aims of the project that I'm doing, funded by the Prevent Cancer Foundation. The first one is to develop a smoking cessation text messaging intervention tailored to Latino smokers living with HIV. The second aim is to determine the feasibility, acceptability, and preliminary abstinence rate of this new intervention among Latino smokers living with HIV. And the study is divided in 3 phases. The first phase is to conduct semi-structured interviews with key leaders of community-based organizations and clinics serving people living with HIV. The second phase is to conduct a user-centered design research with Latino smokers living with HIV to test the features of the text messaging intervention. And the third phase of the study is to conduct a single-arm pilot study with Latino smokers living with HIV. What do I mean by single-arm pilot study? Meaning all participants who are going to be enrolled in the study are going to receive the text messaging intervention. So talking about the semi-structured interviews with key leaders of community-based organizations and clinics serving people living with HIV, the objective of these interviews was to understand the barriers and facilitators of smoking cessation among Latinos living with HIV. So here we have the barriers and facilitators organized by level. We have barriers and facilitators at the individual, interpersonal, organizational, community, and policy level. Some of the barriers we identified at the individual level was a minimal understanding of the benefits of quitting smoking. Some of the facilitators that people reported is that people living with HIV are highly interested in participating in clinical trials and research studies. Another facilitator was that people living with HIV have good medication adherence. At the interpersonal level, some of the barriers were the language barriers. Some of the people we interviewed reported that at their clinic or organization, they do not provide smoking cessation counseling or services available. They don't have them available in Spanish. So this is a barrier for Latinos to receive counseling for smoking cessation. Another barrier was low social support, either for friends or family. One of the facilitators at the interpersonal level was no smoking in social circles. So participants were reporting that people who don't have other smokers in their social circles are more likely to quit smoking. At the organizational level, one of the barriers was the lack of smoking cessation resources and the lack of targeted intervention for Latino smokers. Some of the facilitators was the first HIV care visit. Participants reported that this is a very important visit for participants to start receiving their HIV care, including medications, and this should be seen as an opportunity for helping them quit smoking. Another facilitator at the organizational level was culturally competent care, meaning when the team that were providing services were culturally competent, people were more likely to adhere to both their medications and their medical appointments. At the community level, one of the barriers was HIV and mental health stigma. HIV stigma was related, and some people were saying that when they were offering smoking cessation services at their clinic or organization, sometimes people don't want to go, especially when they have group counseling, because they're afraid of other community members knowing their HIV status. When it comes to mental health stigma, participants were reporting that Latinos living with HIV, they're not very likely to talk about mental health, and they're very private when it comes to their emotions. When it comes to the facilitator, they pointed that COVID-19 was an opportunity for smoking cessation. So this should be seen as a teachable moment for people to quit smoking. At the policy level, one of the barriers was paperwork for insurance, meaning that even though people living with HIV qualify for special and comprehensive insurance programs, the paperwork for them to get enrolled in these insurances, it is kind of difficult for them. So they do need help with that. And one of the facilitators was that these insurance programs were very comprehensive, including for smoking cessation. Participants were reporting that these insurance programs cover nicotine replacement therapies, varenicline, and bupropion for smoking cessation. So we should be taking use of these comprehensive insurance programs. So this is the presentation that I had for today. Thank you very much for listening. Muchas gracias. And here you have my email. Please email me if you have any questions. And I would like to give a special acknowledgement to my mentor, Dr. Ana Paula Cupertino, who I've been working with for the past 5 years. Thank you very much.